Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then papilledema. Right. Papilledema is actually a bilateral optic nerve head swelling. It is a bilateral optic nerve head swelling which occurs due to the raised intracranial pressure. How? Which occurs due to raised intracranial pressure. How does this what happens in middle? Okay. Whenever there is raised intracranial pressure, okay, this raised intracranial pressure will cause disturbance. This right. First, what happens is whenever there is increased cerebrospinal fluid pressure, this will result in disturbance in the pressure gradient across the lamina cribrosa. This disturbance in the pressure gradient across the lamina cribrosa stops the axoplasm present in the prelaminar area. In the prelaminar area, there is oxoplasm, so this will stop the axoplasm present in prelaminar area, resulting in axonal swelling, which results in turn results in venous congestion, leading to extracellular edema, which is called as papilledema. So here this papilledema mainly develops due to increased intracranial pressure. So this is the picture of papilledema, where there is edema and swelling of the optic disc is visualized clearly.
thank you and thank you for watching.